in terms of vaccine, I think it's critical that we are honest about vaccines, and there's been so much misinformation out there. It's hard for people to know who to trust. And so that's part of the reason that when you invited me out, I felt like I should invest the time to give people the straight facts about the vaccine, because there is so much misinformation.
Yeah, exactly. I can go online any day of the week and get competing articles to read. And then you have to decide, all right, so who's the better source of information? Because, quite frankly, you can't always trust the news outlets these days. So, getting it straight from the medical community, I think, is a lot better. And so, there's really, we hear about 3 vaccinations that are available to the public. And could you describe each one of those and kind of what you know of the side effects? Because that's what everybody starts to get worried about, is the side effects related to those vaccines. And just, kind of the rest of what's your view and what do you think we should expect as we watch all this transpire in the news?
Sure. So currently, as of right now in the United States, we have 3 approved vaccines. And one of the things that I think it's important for people to understand is when you hear news stories about other vaccines, that doesn't apply to another brand of vaccine. So brand matters because they use different technology and different approaches to how the vaccine works. So common question that I get sometimes is, I hear all this bad stuff about AstraZeneca. Does that mean that I should not get my Pfizer shot? And I'm like, no, it's an apples to oranges comparison. If you're old enough to remember the Yugos, or a low-end car, that's like saying, well, the Yugo broke down. Should I not get a Porsche? Yeah, they're both cars. It's not a valid head-to-head comparison. So that's one thing, is that the brand matters in terms of how the vaccine works. Now, the Pfizer vaccine and the Moderna vaccine both use very similar technology, and that's a technology called messenger RNA. That technology has been in development for decades, and they were actually working on this as a delivery mechanism to get a more effective flu vaccine. They were working on this for Ebola. They were working on it for Zika. They had kind of perfected it for Zika, and then Zika kind of went away. And so when everybody realized what was happening, they went, 2 of the companies said, hey, let's try to use this approach to develop the vaccine. So you have Pfizer and Moderna, both work by what's called messenger RNA, and that is you essentially take a small little clip of RNA. Now, I say RNA, it's not DNA. It doesn't enter the nucleus of the cell. That's one thing I get asked a lot is it going to change your genetics? Messenger RNA is very rapidly destroyed by the body. So the trick in developing the vaccine was to take this messenger RNA that gives the body instructions for how to manufacture a piece of protein that sticks out on the virus. So the virus has a capsule. In order for that capsule to invade the body, one of the things it has to have is what's called the S spike. So basically, what this little snippet of messenger RNA is, it encodes that virus spike, just the spike. And it is encapsulated essentially in fat bubbles. And then when it's injected into the body, the cells take up those fat bubbles and ingest it in. It just takes it in. It says, oh, here's something that's not supposed to be here. It takes it in. When it takes it in, it takes that messenger RNA and says, oh, here's a set of instructions to make this particular protein. And that protein is actually the spike on the outside of the virus, not the rest of the virus. Can't cause an infection, won't get you sick, will cause some symptoms, but it says make this protein. And so the ribosomes in the cell start cranking out this protein, and then the messenger RNA is destroyed. So the body produces that protein. When it produces that protein, it cranks it out into the bloodstream. When it cranks it out into the bloodstream, the immune response of the body goes, hey, that looks like a virus. We should go attack that. And it starts forming the antibodies for that spike. Now, That's where the side effects come from, because when that happens, you get the same immune response like you would get if you got infected with a virus. So the symptoms, some of the symptoms, particularly some achiness, a little bit of fatigue, not feeling well, those are the major side effects that we see with the vaccine. So those both work in that way, different dosing schedules simply because that's how the studies were designed. And then you have the Johnson & Johnson vaccine. The Johnson & Johnson vaccine uses a slightly different approach. It takes a common cold virus that has basically been incapable of replicating, and it takes a little piece of DNA that also is instructions for how you make this protein, the exact same protein, but it uses that harmless virus to get into the cell. So basically that virus then invades the cell, and when it does, it starts making the protein too, and it has to go through an extra step to get to making that protein. But then it says, make the same protein. And when it does that, then that also results in that immune response that occurs after that. Now, some of the differences, the one shot versus two, has to do with dosing, how the studies were designed, and things like that. But completely different approaches between those. And then the other vaccines that you may hear in other parts of the world right now, those are not in use in the United States. And so really, I just wouldn't even factor them into your thinking right now.
So I hear efficacy is different for the three different vaccines. Can you give us a feel for what the range is there?
It is. The efficacy is different. Pfizer and Moderna both about a 94, 95% efficacy. The Johnson & Johnson vaccine, it's down around 66, 70%. It's higher if you look at what's called wild type, which is the predominantly circulating strains of COVID right now. If you look at different strains of COVID, it's a little bit less effective. So you've got some variation there. However, with the Johnson & Johnson vaccine, with what you're trying to prevent serious disease and hospitalization. It's 100% effective for that.
Yeah, great. But going back to the messenger RNA, so one of the things that I hear quite frequently, we've got a lot of younger adults coming into our workforce, and they're concerned about the potential side effects while they're in childbearing ages. So you tend to see a lot of conversation about that. What are your thoughts on that?
So, there was an open source news story not too long ago about Russian propagation of misinformation about COVID vaccine. I'm not a big conspiracy theorist person, but sometimes I wonder who thinks up this stuff and puts misinformation out there and really what their intent is. There is absolutely no data whatsoever to suggest that the messenger RNA messenger RNA vaccines have any impact on fertility whatsoever. There were people in the original phase 2 trials. Now, you couldn't knowingly enter the trial if you were pregnant. However, there were multiple pregnancies, I think around 15,000, that occurred in the study group either during the original study period or immediately following. The latest data that I saw on this was late December, and it was looking at women that were vaccinated with messenger RNA vaccines, and they had already had 51,000 pregnancies that occurred in that group. And there has been absolutely no credible evidence whatsoever. This was a theory that somebody cooked up. The way that the vaccines work, we wouldn't expect it to cause any issues with fertility. There's no evidence that it does, and we've had a lot of pregnancies in people that have been vaccinated. So all of the major national U.S.-based groups, the obstetricians group, the American College of Obstetrician and Gynecologists, the Maternal Fetal Society Medicine, about a list of 15 different stakeholder organizations representing the obstetricians and gynecologists and reproductive physiology specialists across the country have endorsed getting vaccinated. And and again, and reiterated that there's no evidence as of yet. It's not been fully studied in terms of in pregnancy and things like that, but again, there's no evidence to suggest that it has anything to do with infertility.
Okay. So I just mentioned that it seems that the hesitancy to take the vaccine amongst our workforce in particular is starting to subside, and more people have come forward. In fact, we opened up these appointments up at Aiken Regional, and we had just a instantaneous filling of those, and that was about 1,500 folks, our appointments that we had available to us. So we're starting to, it feels like to me that it's starting to drive. You and I talked about this a few weeks ago when we first started talking about this, and we were talking about, where is society, where are we as a society in terms of, our thoughts around that. And you mentioned that you've been doing a lot of outreach to try and get to the right groups, to start some peer pressure within the groups. Can you talk about that just a little bit?
Yeah, I'll use a term that certainly won't be lost on this crowd, and that is critical mass, right? So people are more likely, especially in an era of misinformation and mistrust and a lot of fear, people are more likely to go, well, my friend Bob got it, and he didn't grow a tail and suddenly didn't start, growing a horn out of his head or something like that. He didn't have any, Bill Gates didn't start tracking him with a microchip or anything like that, or some of the other crazy things that are out there. And then when they see other people then having a good experience with vaccination, they're more likely to then go, well, maybe I should do this. It really doesn't make sense that I take this risk of COVID, yet this risk of vaccination or any potential side effects for vaccination is so low in comparison to the potential outcomes from COVID that it's just absolutely devastating. So then I think once people have had time to think about it, they see others that have had a good experience with vaccination, then that's all it takes to really tip them over. Yeah,
so the real big plug, the reason why we asked you to come in is we're trying to convince more and more people. Now we can't get them right at the moment. That's the big challenge. So what do you see as an outlook in terms of the time frame to get vaccines in enough doses out so that people that want to get it can get it? What's that currently look like? It seems like it's coming shorter and shorter, but yet I got a lot of people that have registered but don't have appointments yet. So how are you guys making out over at Augusta University with that?
Yeah, so over at AU, I think we vaccinated 10,000 last week in a single week. It has really been moving along rapidly, and in fact, I am shocked that a year later from our first case being diagnosed at Augusta University, that we're at this point of having vaccinated, I think nationwide, we've got about 110 million doses administered at this point. To be honest with you, I thought at this point, a year later, we would be talking about a vaccine being released right now. So the fact that we're at this point is really remarkable. And I think what we're seeing play out in the real world is as we have vaccinated people, that we're taking those people out of the chain of infection transmission. And if you look at the data out of Israel, which is really leading the world in terms of the amount of vaccination of the population, they're getting back to normal. They're reopening restaurants and coffee shops and having concerts and things like that. And certainly what's happening there is they've seen the vaccine efficacy holding. They're not seeing cases go back up. And I think that certainly is a bit of an indicator of what we can hope for if we get large numbers of people vaccinated.
So I hadn't seen that information. I guess I'm missing those articles on Israel as a test bed and a success story.
It is. It's quite an interesting study because of, again, the number of people that they have vaccinated has been incredibly high, and the efficacy is really holding true in real life, not just in studies, but in real life and what you're seeing happening there.
So what do you think that's going to look like? I've for a long time, a lot of the conversations were around, it's going to be like the flu vaccine. It's something you got to get every year. You got to look to try and hit the right strain, so the medical providers are having to or drug providers are trying to reach out and make sure they understand what's going to be coming around next time. Have you been in many discussions about that at this stage of the game?
Yeah, so it's still too early to say. So as we mentioned, we've got multiple strains that are circulating right now. The vaccines that are out there, at least the ones approved for the use in the United States, are all still effective against all of those variants. You get a little bit less coverage with one or the other, but the expectation is that right now, even if you get a strain that the vaccine is less effective against, that it will still be effective at preventing severe disease. So it may be that as we vaccinate people and as we build up the body's immunity, that if we get exposed to a new strain, that it'll be simply reduced to a cold or a day like we just don't feel well. It's also possible that we will get a strain that emerges that evades the current vaccine design. And if so, then we may have to have some boosters. We also still don't know how long the immunity is going to last from the vaccination. We're studying that. It appears to be longer lasting. It appears that we're creating some memory within the body's immune system to allow it to respond better. I'm still optimistic that this will be a longer term vaccination. Exactly how longer term, we don't know yet. Remember, the coronavirus, although it does mutate and we get these strains, it doesn't mutate quite as fast as the influenza vaccine does, the influenza virus does. And because it doesn't mutate quite as fast, we're not really seeing that escape or the complete mismatch between this flu strain and this flu strain yet. So time will tell. I'm still optimistic that this is not going to be necessarily a yearly shot. It's also possible that we're going to end up with a booster having to be given periodically, but we don't yet know when that's going to be.
So it'll be a little while before we get there.
It's going to be a while before we know.
Yeah, okay. Well, I mean, in the big scheme of things, it would be nice just to be able to take the mask off and shake hands, right? We had to stay a little bit apart and not be able to shake hands here this morning. I think that's what really is driving people to think what normal. That'd be really nice to get back to that. So it's been a little bit overwhelming what we've seen transpire over the last year. A lot of changes to the way we interact as a society and as individuals. What are you looking forward to most out of the back end of kind of the slide towards most of us have been vaccinated and we'll get there? But what are you thinking about for this summer?
I'm looking forward to going scuba diving, and my favorite place on earth besides home is a country that now accepts vaccination in lieu of testing. I don't even have to get tested to go and visit Belize, and I'm certain there will other countries that will follow. But to me, that's a big deal. That's my happy place, and I'm looking forward to being able to do that without having to get a test. Yeah, do I have to show my vaccination card? Yes, but still, that's a great perk to not only feel safe while I'm traveling, but also not have to go through all those hassles that we've had to go through in the meantime. Additionally, the healthcare system has had a rough year. It's been a terrible year. I'll just be honest with you. It's been emotionally difficult. One of the most frustrating things that we see is we see patients that don't end up as a mortality in the numbers, but nobody ever sees the suffering that those people go through. We were talking about a patient the other day that was in the hospital for 9 months with COVID. 9 months it took us to get him to a point where he could be discharged. He's not a mortality statistic, but he's one of the people that's been devastated, and that's not uncommon. And the degree of devastation that people have from this, the fatigue, the not being able to exercise and do the things that they were able to do prior to getting COVID, are just some of the saddest cases. And so when I hear people cite statistics as a reason to not get vaccinated, for example, why would I get vaccinated for a disease that I've got a 99% chance of survival? My response to that is always, death is not the only outcome from this disease. We get long-standing lung disease, we get neurologic problems. We have people that have heart attacks and strokes because of the immune response getting out of hand. We have people that are just absolutely debilitated by this disease. So I remind people, death is not the only outcome here. So when you're looking at the numbers, be very careful. But we're looking forward to people getting vaccinated and not seeing sad stories like that again, and getting back to just the normal pace of healthcare. And that's probably what I'm most looking forward to. Maybe scuba diving. I don't know. I'm not. They're head and head.
So because of confidential information, we don't share very much information about who and what. Even out here amongst our workforce. So a lot of people don't know that we've had, a number of people that have passed away related to COVID. We've had a number of people that have been in the hospital for a very long time. And we've had some people that have been damaged, have damaged health that will last the rest of their life because of the implications. So there's, there's no shortfall of downside, even though it's a low percentage. Yeah. So I guess I can't resist. How many people have had their vaccine that we don't have very many people in the room? Just curious. Wow. So what would you say? 60%? Right there? 70% maybe even? Pretty doggone good. So thanks for taking the lead. Of course, these are the leaders of my organization. They have to come and sit with me. That they don't get to sit on the other end of the camera. So I hope you panned around a little bit, Tom, so that you could see how many hands were up in the air. That's great. So we really appreciate you coming. Was there any questions that we ought to ask?
Just a couple came through. If you've already had COVID, do you need the vaccine?
And the answer to that is yes. So I had COVID. I was one of the fortunate ones to have fairly minimal symptoms. But here's the problem with if you had COVID, whether or not you should get the vaccine. We see variable immunity that develops from the disease itself. So I'm sure everybody here has seen the person that tested positive but never got sick. Right? That person likely does not develop long-lasting immunity to COVID. We see this variability in whether or not people develop antibodies. And so we get varying immunity. And what we need to have is that long-lasting immunity, something that is unpredictable from somebody that's had COVID. So if you've had COVID, what we recommend is that you wait 90 days after having COVID. Now, you can get vaccinated as soon as you're off of isolation. What we see in that group, if you get vaccinated immediately, is that those people tend to have a little more severe side effects than if you wait longer. Now, it's still safe. We don't see adverse events. We don't see serious problems. But we do see the side effects go up in the people that get vaccinated immediately following having COVID. So the recommendation is to wait 90 days. It's 90 days because reinfections are rare. Almost don't occur in that first 90 days. It does happen occasionally, but it's really rare. So that's where the 90 days comes from.
Okay. And do your opinion on the recommendation for mask wearing after vaccination end after a certain percentage of the population is vaccinated?
Yeah, that's a tough one. People ask me, well, why still the mask mandate? I'm glad the CDC changed their guidance on this. I had my first meeting with my leadership team the other day, and everybody in the room was vaccinated. We were under the limit and was like, oh, thank God we can all take our mask off and have a regular meeting like we used to have. However, when you get out into the public, that gets tricky because we don't know who's vaccinated and who isn't. So if you're out in the public, we really just can't drop those mask mandates yet. And even when we get larger portions of the population vaccinated, we're still going to have unvaccinated people out there. So I think it depends on how that plays out in real life. I would be cautious. The last thing I want to do is to have cases start occurring again and us to start bumping the numbers back up. maybe once we get to that 50% mark combined with some immunity from the people that have COVID and that have had COVID, then maybe we're there. Maybe, I think it's a little early to say.
For the vaccine that uses the fat bodies to transfer the RNA, does an individual's body mass index impact effectiveness?
Oh, good question, but no. So once, the little fat globules get gobbled up by the cells, and it creates a very reliable, predictable immune response, regardless of the body size. When you get on the very small end of that, and with children, they are doing the trials now to look at dose for children, but for adults, whether you're on the high school skinny end of that, or if you're on the those of us that like to eat end of that, there's no difference in immunity that develops.
Okay, I think you answered everything.
Yeah, Ted.
Do you have opinions on which vaccine you recommend?
Which vaccine would I recommend that people get? The one that's made available to you. It is more important to get vaccinated than it is to be picky about which vaccine that you get. And I can't say that enough. So if you get signed up for a vaccine and you get there and go, it's the Johnson & Johnson vaccine, great. Be thankful. You're one and done. 100% effective at keeping you out of the hospital and from dying from COVID. And that's what we're trying to accomplish, right? So I would say whichever one's available to you. In some select situations, there are reasons, for example, if you have an allergy to polyethylene glycol, if you have a history of anaphylaxis, there is some nuance to this for people with severe allergies, and that being people that require the use of an epinephrine pen to rescue them from an allergic reaction. So there are some nuances where you need to specifically select a vaccine, but otherwise take the one that's available to you.
And that would be confer with your doctor and make sure that you understand which would be the best option if, in fact, you have that level of allergic reaction.
Correct, and that's the only one where I would say there are a couple of situations. If you're undergoing cancer treatment, things like that, there might be some nuance there about timing of when to get vaccinated. So those with really serious, complex medical problems, you do need to talk to your doctor. However, I will tell you that equation most of the time is the more medical problems that you have, the more your risk of a really bad outcome from COVID, and therefore the bigger reason to make sure that you get vaccinated.
Yeah, good. Anybody else here in the room? Go ahead, Dennis.
You hear a lot about the second vaccine and the range of side effects. What do you expect?
Yeah, so it's interesting. Second dose is certainly a little more prominent. I'll be kind and use those words. The second one is like a 24-hour, in very rare cases, 48-hour flu, and people feel terrible in some cases. Some people develop fever and chills. Again, that is not everyone, but we do see the side effect rates going up with second shots. And that's because your body already recognizes it after the first shot. You get the second shot, and then you get those side effects. However, I will tell you, having had COVID, it's nothing compared to having COVID. So I would recommend you take the short symptoms and side effects rather than what are absolutely horrific impact and side effects from actually getting COVID. I tell people, just think of it as a little taste of COVID. I assure you, you would much rather have the vaccine side effects that then go away. But they do occur. What are they? Fever, chills, backache. Occasionally we see rashes, pain at the injection site, probably is most common. Some people develop a knot at the injection site. And that varies depending on a person's immune system. Ironically, the older people get, the better they tolerate it and the less side effects that they have. The younger people tend to have, some more, they have a better revved up immune system, and they tend to have some of the more severe side effects in terms of just the severity of it, or that it lasted a little bit longer.
Yeah, so Dennis, since you just recently had a birthday, it means you're older. You can tolerate it better. Yeah, Wyatt.
So Dr. Coule, I want to thank Augusta University. I got an opportunity to experience one of your stations at Tech, and it is a machine. I was impressed at the efficiency, at the professionalism. Living with a couple nurses, with the young nurses that distributed, it is really a great outreach. I want to thank you.
Oh, well, thank you for the kind words. We really do try to make it as pleasant an experience and as efficient as possible. And that's a great partnership both with Aiken Tech, USC Aiken. The student nurses from those locations help us by helping staff that clinic. And our pharmacy team and nursing team, I think, have really done a great job with that. But thank you for the kind words.
So, go ahead, Don.
Here that really would wrap up very nicely. It says, thank you for having Dr. Coule in this session. Very informative, excellent layman's explanation of the vaccines, and hopefully will go a long way with helping our folks feel better about getting the vaccine. So much appreciated.
Oh, thank you for the kind words.
I think I'm just going to stop right there. You couldn't ask for better than that. Yeah, thank you for that comment. And thank you for coming. We are going to make this clip of this interview and session available for everybody. We're going to put it out, through YouTube or whatever our link is that we're going to do. So you guys have seen it first, but we're going to make this available to everybody because we think, everybody's interested in kind of where we are as a society and where are we going. So really appreciate you taking the opportunity to come over and meet with us here a little bit. I know you're a pretty busy guy and got lots of stuff to do, so hopefully we haven't kept you out of circulation too much here this morning.
No, it's my pleasure.
Yeah, great to have you.